Hello guys, welcome back again to my YouTube channel. So this is Paul Richard Pinoy Nurse here in Singapore. So for my today's content guys, I'm going to share to all of you my grades. Yes, my grades when I study the Advanced Diploma in Nursing here in Singapore. So I'm going to share to all of you. Anyways, if you all notice, right, I've been uploading videos quite often now because I'm practicing for my speaking. They said for you to improve your speaking, you need to see yourself how you speak. I'm not sure if that's real or not. Anyways, so let's go back to my content. So I'm going to share to all of you my grades. So you all know, right? I finished my advanced diploma in medical surgical in NYP, Nanyang Polytechnic. So let's get it on. So actually there is 3 semester, right? So I consider 3 semester. So first semester, if you can see, we'll show. Don't know. First semester we have 4 subjects: cardio, respi neuro, pathophysiology, and health assessment. So guess what? Which is my favorite subject? Actually, my favorite subject is pathophysiology. So let me share my grades in applied pathophysiology and pharmacology in medical surgical nursing. So ta-da! I managed to get only A. So yeah, I really love this subject, especially the professor, Dr. Param. I'm not sure if he's watching my content. Anyway, shout out to Dr. Param. And I've learned a lot. Actually, in Philippines, we are quite detailed also in pathophysiology when I'm taking my degree. So maybe that's the reason why I managed to cope well in this subject. But yeah, I do love pathophysiology. I love how Dr. Param explained it easily that I can understand it and remember it easily. So yeah, that's for pathophysiology. Second, cardiovascular. Actually, I love cardiovascular, cardio. But I'm not sure if I really, how to say, because I managed to get A as well in cardiovascular. So, but I'm really not sure if I really I deserve this grade, because honestly speaking, I'm still struggling with ECG reading. But other than that, I do understand a lot about the cardio diseases, medication, cardio-related medication. So, yep, for cardio, I managed to get A. Third, respi and neuro disorder. This one, I find it quite tough, especially the respi. Respi, I think the most memorable in respi is understanding how to do lung function test, the result, like how to interpret something like this. It's really a nightmare when I'm trying to understand it. But other than that, I'm not sure if I can still remember it. And for neuro, I do understand I understand more regarding stroke. But yep, my grade for this subject is for respi neuro is combination is B+. So I didn't manage to get A, but it's B+. It's okay. B+ is B+. And lastly, for first semester is the health assessment and clinical decision making. This one you need to do health assessment to your patient. You need to do HPI, history taking, like what usually doctor will do, like auscultation, do the assessment. Actually, nurses must do as well. So, it's like one of the memorable thing about this subject is when we are practicing and we're trying to remember the step on how we will do the assessment. Example, respiratory, cardiovascular, neuro, musculoskeletal. So we need to do all this assessment, and we have a partner. So my partner is Eugene. I'm not sure if he's watching. Yeah, he's my partner. He's quite smart now. He can remember everything. He's the one who's correcting my English. Other than that, I managed to get B+ because the final exam is you will be given a 2 system. Then you need to after you do history taking to the patient, you need to decide what system you need to assess, something like this. Example, you found it like you need to assess the cardiovascular and neuro. You need to do neuro to this patient, then you need to do this too. So my grade for this is B+. Okay lah, still okay, B+. So that's for the first semester. So let's go to the second semester. Second semester I didn't enjoy. I'm not happy with my grades. I don't know why. But second semester has endocrinology, 1 subject, and others. Second is GI, hepato, and others. And EBP. EBP is the most, I don't know, because I don't have any idea about this. I mean, I took my degree 10 years ago, and I really forgot it. So I really struggle a lot, especially the presentation, essay. However, I didn't expect that it will turn okay to the point that our EBP was chosen to present in all advanced dip cohort. But my grade, doesn't mean even I presented. I'm one of the presenter. Doesn't mean I will get A. So I managed to get B+. But I do accept why I managed to get B+, because my essays really sucks. While I'm reading my essay regarding this EBP, I cannot, because yeah, I really don't have idea. But I've learned a lot about this EBP. So maybe that's the reason why I'm coping well in my master because now I know how to do this academic writing. Yep, that's for my EBP. EBP is B+. So for endocrinology and GI hepato, I am quite surprised with my grade, but I think I didn't do well with my exam. So for these two subjects, I managed to get the B. So actually, I was expecting at least B plus, lah. But I don't know. But I didn't. I get B. So it's still good, but because usually I will study hard. I will make an effort to study. But yep, I didn't manage to get B plus, but B is still okay, and I've still learned a lot for these two subjects, lah. And lastly, for third semester, we will have a clinical attachment. Clinical attachment 1 and 2. So we will go to different hospitals. So I went to Tan Tock Seng, Kutekpuat Hospital, and SGH and National Heart Center. So for the first clinical practice, I managed to get B+, still okay. And for the second, when I go to Kutekpuat Hospital, I managed to get A. Thank you to Miss Pamela. So yeah, so I've learned a lot as well for this clinical practice because we've been exposed to high dependency and somehow ICU setting now. So to summarize my experience studying in Singapore as a foreign nurse, I've learned a lot in this advanced diploma in medical surgical. So the problem now, since I started working, I started to forget everything. Otherwise, but yeah, I really love it. So shout out to my course. Need to shout out, of course, later on. They watch. No. Shout out to Mr. Julian and Miss Adi. Thank you for guiding us, and to all my classmates who become my friend as well. Shout out to all of you. See you soon. So because I guess the graduation will be next year, I guess May. I'm not sure. Hopefully I can attend the graduation and can see them all. And all of them are busy already with their work. And I guess that's it. And the reason why I'm sharing this is the same month when we started Advanced Dip. So it's like a year already. Yep. So my total GPA. How much my total GPA? My GPA is 3.57. Okay, at least 3.5. They keep telling that you must get 3.5 if you're sponsored. So before I'm aiming for high, like I want at least 3.8. But then I realized too difficult. There's a lot of smart people. But yeah, coming from a foreign country, I didn't study here in Singapore. I still managed to have a good grade. And also I really learned a lot. I realized in Singapore they're really in depth. The study is really in depth, and they like academic writing, and that's it. I guess I'm going to I'm really to the point that if you really have plans to study for advanced dip, I highly encourage everyone because you will learn a lot, and it's quite fun because you will meet friends, and aside from meeting friends, like I said, you will learn a lot. I guess that's it. Bye bye.